Hello, my name is Bethany. I am a donation support specialist. And do you understand why we called you and asked you to come in today? Okay, yeah. Well, let me explain our process a little bit. You signed up for the National Bone Marrow Registry with a cheek swab a few months ago. Okay, and it just so happens that we have a couple of patients in need of a bone marrow transplant. So I was hoping to ask you some additional screening questions, as well as do a blood draw and a very short checkup to make sure that you are healthy. Okay. Yeah, I think that is so wonderful that you did sign yourself up. So we'll do this testing and just determine whether you would be a good match. Okay, great. I want to start by just reading part of this form to you and having you sign it. It's just kind of a disclosure form. Okay. And can you please tell me your legal first and last name? And can you spell it, please? And your date of birth? Okay, perfect. And I just have to ask, do you authorize the recovery of the following tissue? And this will be bone marrow, and it will be used for transplantation. Okay. Okay. And there's a couple statements that I do want to read to you just so that you are fully informed. So, multiple organizations, including nonprofit and/or for-profit organizations, may be involved in preparing and distributing the gifts for transplant. Okay, and just so that you are aware, we are a nonprofit organization, but there are some organizations that we work with that are for-profit, and those are mostly just our hospitals and transport organizations. So the priority for the use of this bone marrow will be in the United States. However, there may be a need to distribute internationally. And is that okay with you? Okay. Wonderful. And I just have a couple more statements. So tissue donation, and that includes this bone marrow, is a confidential gift in which you will not be charged for costs related to donation, and you will also not receive monetary compensation or valuable consideration for this gift of donation. Medical and other relevant records, including reports from a primary care physician or a pathologist, will be obtained and released to all agencies involved with the donation. Okay. And the collection and archiving of blood specimens and possibly tissues will occur for the purpose of biopsy or other testing to determine donor eligibility and for reporting applicable transmissible diseases. The collection of photographs and/or imaging may also be necessary to determine donor eligibility. Okay, and so what some of that means is we will have to do some blood testing. We will test for diseases. We don't want to transmit anything to our patients. Of course, that is top priority. We're trying to assist them with their health. So, and we normally don't have to take photographs for this type of procedure. However, if when you go back there for the blood draw, they notice any kind of concerning bumps or anything like that, we may just ask if we can take a picture. So that's what this is in reference to. Okay. And do you have any questions or any concerns for me up front? Okay, not at this time. And I do just have to ask you, for legal purposes, has the information received been clearly explained, and have all questions been answered in a satisfactory manner? Okay, now if I could just have you sign this and date it. Okay. All right, great. And you can just set that to the side when you're done. I do want to do a very quick physical inspection just to make sure that I don't see any signs of illness and to make sure that your heart rate and everything is fine. Like I said before, they will only be doing the blood draw today to make sure and finalize whether you are a match for any of these patients. Okay. Okay. So the first thing is I am just going to take a look at your face, okay? Okay. Okay, good. All right, can you open your mouth for me? Good, okay. Let me just grab a light and make sure. Okay. Open your mouth again. Okay. All right. Okay, perfect. And I'm just going to take a look into your eyes so you can look straight forward at me or look up if you need, okay? But I need to be able to see in. Just make sure there's no conjunctivitis or anything else to indicate infection. Okay. All right. Perfect. Next, I am just going to put on a stethoscope. And I just want to listen to your breath sounds, make sure there's nothing raspy or clogged in there, and then I want to also make sure that your heartbeat does sound regular. So, okay, hold still for me. Good. Now I'm going to ask that you take in a deep breath. Okay, go ahead. Okay, good. And another deep breath for me. Okay, good. Okay. All right, excellent. Everything does seem to check out. And are you feeling as well? How are you feeling as well? I just want to make sure that you don't have anything that feels like an illness or anything like that. Okay, so you feel healthy as a horse? All right. I'm just going to take these gloves off and get into my questionnaire. And I did want to let you know that this is quite a lengthy questionnaire. And I also do want to advise you of the sensitive and personal nature of some of these questions. Now, these are not meant to be offensive. They are similar to those asked when somebody donates blood, and we do just have to ask these questions for the health of those who may receive your gift, okay? Okay, wonderful. So the first questions are about infectious diseases, and you may have heard about these in the news, okay? So, were you ever told by a healthcare professional that you were infected with the Ebola virus? Okay. And were you ever told by a public health authority that you could have been exposed to the Ebola virus? Okay. Were you ever told by a healthcare professional that you were infected with the Zika virus? And did you recently have any symptoms such as joint pain? A little bit of joint pain, okay. And when did that start? Okay. And can you please tell me the reason for the joint pain? Or what it feels like? Okay. All right. Have you recently had any conjunctivitis? And that is also called pink eye or red eye. can you please describe any of your travel within the last 6 months? So have you traveled outside of the country at all? Okay. Okay, I understand. And I'm now going to start the main part of the questionnaire. This is where we will spend the majority of our conversation, okay? Okay. And did you have a family physician or specialist? Okay. And can you please tell me the name of that physician and where they're located? And when was your last visit to that physician? And what was the reason for the visit? Okay. All right. Did you ever use a medical facility such as a clinic or an urgent care center? Yeah, and the question is asking ever. Okay. And do you know approximately when that was? And what was the reason for that visit? Okay. Okay. And did you take any prescription medication recently or on a regular basis? Okay. And either what is the name of the medication, or if you can't remember that, just what is it used for? Okay. Okay. Do you take any non-prescribed medication or dietary supplements? Okay. And I'm now going to go through a list of recent symptoms with you, and that is just to determine that you are healthy enough to go ahead through with this donation, okay? Let's see. Did you recently have any symptoms such as a fever, a cough? Okay. Any recent diarrhea? It's okay, you can tell me. Okay. And when was that? Okay. Have you had any swollen lymph nodes or glands in your neck, armpits, or groin? Any recent weight loss? Okay. Okay. Have you had a rash? Any sores in the mouth or on the skin? Have you had any recent night sweats? Severe headache? Okay, some more of just some moderate, mild headache. Okay, and when would you have that? Okay. And can you describe the severity of the headache and the reasons for it? Okay. Okay, good. Any recent rapid decline in your mental ability or your mental functions? Okay. Have you had any recent seizures? Tremors? Or any recent difficulty walking? Okay. And this next one is going to sound just a little bit funny, but it says, do you know anyone who had a smallpox vaccination? So those were given more routinely in the 1970s, and it would leave a little scar on your arm. Okay, you'd say you probably do know someone who had that. Okay. The follow-up question just says, was that person vaccinated within the past 2 months? No? Okay. Okay, good. And in the past 12 months, were you in lockup, jail, prison, or any juvenile correctional facility? In the past 12 months, were you bitten or scratched by any pet, stray, farm, or wild animal? Okay. Maybe a pet, little scratch. Okay. The animal was not suspected to have rabies or anything, correct? Okay. And it didn't require medical treatment. Okay, good, good. And in the past 12 months, were you told by a healthcare professional that you have a West Nile virus infection? Okay. All right, excellent. And in the past 12 months, have you had any shots or immunizations, such as for the flu, MMR, yellow fever, hepatitis B, etc.? Okay. And when did you have that? Okay, excellent. And this is just a reminder that these are standard questions we do have to ask in every interview, okay? So just answer just like you are, to the best of your knowledge, with a yes or a no. And in the past 12 months, did you get a tattoo, touch-up of an old tattoo, or permanent makeup? Okay. In the past 12 months, did you have acupuncture, ear, or body piercing? In the past 12 months, did you live with a person who has hepatitis? In the past 12 months, did you come into contact with someone else's blood? And in the past 12 months, have you had an accidental needle stick? Any little accidental poke? Okay, all right. Perfect. And did you ever have a transplant or medical procedure that involved being exposed to live cells, tissues, or organs from an animal? And have you ever lived with or had relations with a person who had such a procedure? Okay. Were you ever told by a physician that you have a disease of the brain or a neurological disease, such as Alzheimer's, Parkinson's, multiple sclerosis, or epilepsy? Okay. And did you ever have any kind of surgery? Okay. And what kind of surgery did you have? Okay, and when did you have that surgery? Just approximately. We will get full access to your medical records if you are a match for one of these patients. So this is all just approximate. Okay. And where did you go to have that surgery performed? Like what hospital? Okay. Okay, perfect. And did you ever travel or live outside of the United States or Canada? Outside. Okay. And where did you travel or live? Okay. Okay. And when was this, and for how long were you there? Did you ever receive a blood transfusion or other medical treatment outside of the United States or Canada? Okay, perfect. Done with that page. There are still a few more questions left. I know it's kind of lengthy, but we are getting there. Okay. And were you ever a U.S. military member, a civilian military employee, or a dependent of either? Okay. Did you ever use or take growth hormone? Growth. Yeah, okay. And did you ever have a positive or reactive test for the HIV/AIDS virus? Hepatitis? HTLV1 or HTLV2, and those are the precursors to leukemia and lymphoma. Okay. And did you ever have liver disease or hepatitis? Did you ever have cancer? Okay. Did you ever have diabetes? Okay. And did you ever have any eye problems, procedures, or surgery? Yes, any kind of eye problems. So that would go from cataracts or glaucoma all the way to just wearing glasses or contacts. Okay. All right, so go ahead and tell me about it. Okay, and was any kind of surgery or procedure ever necessary to correct that? Okay. And then which eyes were affected? Was it one or both? Okay. And can you please provide me with the name and phone number of your eye doctor or eye clinic? It's okay if you don't know the phone number offhand, but if you could provide me with the information, we can give them a call later. In case it becomes necessary, I don't foresee us needing to give the eye doctor a call, but just so we have it. And did you or any of your relatives have Creutzfeldt-Jakob disease? And that's also called CJD or variant CJD. This is a degenerative brain disease. It's similar to mad cow. Okay, no, good. Good. And I just have 4 more questions. So are there any other medical conditions that you're aware of that we have not discussed today? Okay. Do you now have any concerns that your donation should not proceed? Regarding these questions, are there other people, including healthcare professionals, who may provide additional information? I know that's kind of a strange question, but basically, is there anything in here that you're not completely sure about, that perhaps you think that we should clarify with one of your doctors, or just anyone else who might have that answer? No? Okay, good. And do you have any questions about these questions that I've asked you today? Okay, well, that does complete all of the paperwork necessary to move forward with the donation, should everything match up. So now all that's left to do is for us to take a blood sample. They're also going to get your blood pressure and your height and weight in the other room. And then if you are a match, you should get a call back from us in about 3 to 5 business days, okay? Okay. Well, we do appreciate you registering so much. This can make a huge difference in somebody's life, so. Okay. Well, you can go ahead and head over to the other room now. Thank you. Bye.